Hi, my name's Sam. I'm going to be your student nurse taking care of you today. How are you?
I'm good.
Good. Okay. Can you tell me your name?
Anthony.
Okay, Anthony. Can I please check your patient armband? Good. Can you clarify your date of birth for me?
June 11th, 2004.
Okay. I'm going to start off by asking you a couple quick questions. First is, where are we right now?
A living room.
Very good. Okay. Who's the President of the United States?
Donald Trump.
And what is today's date?
May 1st, 2020.
Good. Patient is a Caucasian 15-year-old male who appears well-nourished, well-groomed, with clear speech and good posture. Previously to this, we took vitals, a blood pressure of 110/70, a pulse of 70, a respiratory rate of 14, and a temperature of 98.6. Patient is alert and oriented and has appropriate and relaxed facial features. So we weighed you and you weighed 120 pounds and you were 5'2", correct?
Yep.
Okay, perfect. All right, Anthony, so first we are going to start off by looking at your hands, your nails, and your skin. How does that sound?
Good.
Okay. Let me just take a look. Good. Skin is warm to touch. Good. Now I'm going to check his capillary refill. Good. Capillary refill of less than 2 seconds. All right, now I'm going to move on to your head. I'm going to check your scalp and your hair, and you're going to let me know if you feel any pain or tenderness.
No, I don't feel anything.
Okay, no pain reported. Good. I'm going to take a look at your face. Good, face is symmetric, eyebrows are symmetric. I'm going to palpate your sinuses. Let me know if you feel any pain or tenderness.
Nope.
No pain, tenderness, or swelling to report. Great. All right, I'm going to assess cranial nerve 7. So can I have you pucker your lips? Good. Puff your cheeks. Good. Smile. Good. Close your eyes. Really tight. Good. And scrunch your forehead. Good. Okay. That was good. Cranial nerve 7 is intact. All right, now we're going to move along to your eyes. So first we're going to do this, we're going to have you stand up. Stand right about there, and we're going to have you cover your right eye, and you're going to read the lines all the way to this line. Go ahead.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, F, C, T, E, C.
Good. Okay, take a second to get your eyes back. Good, okay, close your other eye and do the same exact thing.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, F, O, T, E, C.
Good job. Patient's vision is 20/20. You can have a seat right back down here. All right. Now we're going to test cranial nerve number 2, confrontation test. So if you want to close your right eye, look at me, and then tell me when you could see my finger, but keep your eyes at me.
Yep, I can see it. Yep. 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 Yep.
Look at me. Other one.
Mhm. Yep. Yep. Yep.
Good job. All right, so now we're going to test cranial nerves 3, 4, and 6. So you're just going to take a look at my pen light. You're going to stare at me, but you're not going to move your head. You're just going to move your eyes. Very good. So cranial nerve 3, 4, and 6 are intact. All right, now we're gonna look for pupil constriction. So I'm gonna shine this pen light in your eyes. Very good. Pupils constrict to light and react to light. And I'm gonna have you look in the distance. Good. Pupils dilate in the distance. All right, Anthony. Now we are going to move on to your ears. I'm going to take a look at your ears. I'm going to look for redness, swelling, pain, or tenderness. So let me know if you feel any pain or tenderness.
Nope.
Okay, good. No pain or tenderness reported. Ears are symmetrical. All right, now we're going to take a deeper look into your ears. Good. Okay, so tympanic membrane is pearly gray, no swelling or discharge. We're going to do the same thing over on this ear. We're going to pull down and look up. Good. So same thing with this ear. Tympanic membrane is pearly gray, no swelling or discharge to report. Okay, so now we are going to do the whisper test to test your hearing. So I'm going to stand on either side of your ear, and I'm going to whisper 3 words in your ear, and you are going to repeat them back to me.
Car, cat, dog.
Good. We're going to move on to this ear. Tree, water, pillow.
Tree, water, pillow.
Good job. Okay. All right. Next, we are going to inspect and take a look at your nose. So first, I'm going to inspect your nose. Good. Nose is symmetric. No lesions or redness to report. All right. Now I'm going to take a look up your nose for a deeper look. Good. Good. Septum is midline. No perforations. All right. Now we're going to test cranial nerve 1, the olfactory nerve. And I'm going to have you close your eyes. I'm going to put something in front of your nose, and I'm going to have you spell it and let me know what you think it is.
Coffee.
Good. Coffee. Coffee's very strong, right?
Yeah.
Good. All right, good. Very good. All right, next we're going to assess your mouth and your tongue and your throat. So what I'm going to have you do is open up as wide as you can and say ah. Good. Gag reflex is intact. Okay, tongue up, tongue down. Good. We're testing cranial nerves 9 and 10. Good. Now I'm going to have you stick your tongue straight out. Good. Cranial nerve 12 is intact. Perfect. Okay, now we're going to move down to your neck. So I'm going to inspect it, and then I'm going to feel for any tenderness, check your lymph nodes. You're going to let me know if you feel any pain. Good. So neck is symmetric. Very good. All right, now I'm going to palpate. Let me know if you feel any pain or tenderness. I'm going to palpate your lymph nodes. Any tenderness?
Nope.
Okay. No pain or tenderness to report?
Mm-hmm.
Perfect. All right, Anthony. All right, Anthony, now I'm going to take a look at your carotid arteries and your carotid pulses. So first I'm going to feel for your carotid pulse. Good. I'm going to check the next one. Very good. Pulse is 2+. Okay, now I'm going to look at his carotid artery. I'm going to listen for bruits. Bruits are turbulent blood flow. Good. Move on to the next side. Very good. No bruits are present. All right. As we move down, I'm going to test cranial nerve 11. So I'm going to have you sit up a little bit. I'm going to have you shrug your shoulders against my pressure. Good. Very strong. Cranial nerve 11 is intact. Okay. So now I'm going to check your breath sounds and your chest. So first I'm going to start off with your posterior and lateral chest. So I'm going to have you take a seat right up here. Good. I'm going to expose your chest. First, I'm going to palpate, and every time I move my hands down, I'm going to have you say the word 99 to feel for tactile firmness.
99. 99. 99. 99.
Very good. All right, now I'm going to have you do the same thing once more, but I'm going to listen this time with my stethoscope.
99. 99. 99. 99. 99. 99.
Good. All right, now I'm going to percuss your lung fields. Very good. Okay. Any pain or tenderness?
Nope.
Okay. Can you sit up straight for me? Perfect. Now I'm going to put my hands on either side, and I'm going to have you take a nice deep breath. Very good. Patient chest expands symmetrically. All right. Now I'm going to listen to your breath sounds. Take a big deep breath every time I move my stethoscope. Okay. Deep breath in. Very good. Breath sounds and lung sounds are normal. All right, now we're going to do the same thing for your anterior chest wall, so I can have you take a seat right back on the bed. All right. The same thing, we're going to start off with tactile firmness, so we're going to have you say 99 every time I move my hands down.
99. 99. 99. 99.
Very good. Same thing. I'm going to have you say 99, but this time I'm going to listen.
99. 99. 99. 99. 99. 99.
Very good. All right, now I'm going to listen to your breath sounds. Same thing, take a nice deep breath every time I move my stethoscope. Deep breath in and out. Good. 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 Very good. All right. So now we're going to take a listen for your heart. Excuse me, to your heart. Very good. Okay, S1 and S2 sounds are present. All right. So now we're going to take a look at your upper extremities and check your range of motion. So if I can have you stand up for me. Very good. All right, so let's do some arm circles forward. Good. Backwards. Good. Crisscross. Very good. Up. All the way up. And then behind. Good. Any pain or tenderness or a little uncomfortable? No? Okay. You get to back down. Patient has full range of motion in the upper extremities. And then take a look at your skin. Okay. Skin is warm to touch. No lesions or redness. Okay. All right. Now we're going to move down to your abdomen. I'm going to auscultate, I'm going to palpitate, and I'm going to percuss. First, I'm going to listen for some bowel sounds. So when was the last time you ate?
Like an hour ago.
An hour ago. Okay. And what did you eat?
Donut.
Donut. Oh, I wish I had a donut. All right, so I'm gonna have you lay down. All right, so I'm gonna first auscultate in all four quadrants to listen for some bowel sounds. Very good. So vowel sounds are present and are normal active. All right, so now I'm going to percuss to find any dullness in all 4 quadrants. Very good. All right, so lastly for the abdomen, I'm going to palpitate. So let me know if you feel any pain or tenderness. I'm going to be looking for tenderness or masses. I'm going to do deep, firm, and soft pressure. Very good. Okay. Any tenderness while I was doing that?
Nope.
Nope. Okay, no tenderness to report. All right, I'm going to have you sit up. Very good. All right, next we're going to check your lower extremities. We're going to check your skin. Good. Skin is warm to touch, no lesions to report. All right, I'm going to feel for your popliteal pulse. You can put your foot straight. Very good. Now I'm going to check your dorsal medius pulse. Very good. All right, now we're going to check your range of motion in your lower extremities. So if I can have you lay back. Okay. I'm going to have you take your knees to your chest. You could do one at a time. Really good. Other one. Good. Both together. Good. Down. Now I'm going to look at your ankles. So if you want to move your ankles up and down, circles. Good. Toes. Wiggle those toes. Really good. Okay. Now I'm going to take a look at your toes. Good. Check your capillary refill. Good. All right, now I'm going to test your muscle strength. So if I can have you stand up. All right, stand right over here. Face me. Okay. Push up. Good. Push down. Good. Push side. Good. Other side. Good. Sit down. Push. Good. Pull. Very good. No weakness. Any pain doing that?
No.
Good. No weakness or tenderness to report. Okay, now I'm going to have you stand up. I'm going to take a look at your spine. So I'm going to have you bend down very slowly. Good. Good. Now I'm going to have you come up very slowly. Very good. So no curvature of the spine. Good. Now I'm going to have you bend side to side. Other side. Very good. Full range of motion there. All right. So now I'm going to do a test. I'm going to have you sit down. All right. So I'm going to have you close your eyes, and I'm going to put an object in your hand, and you're going to try to tell me what it is, okay? Okay. You can feel for it.
Spoon.
Yep. Good job. A spoon. All right. So lastly, I'm going to observe your gait. So if I can have you stand up. Okay, stand right over here. Good. All right, I'm gonna have you walk to me, heel to toe. Good. Now I'm gonna have you turn around and go on those heels. Good. And turn around on those tippy toes. Good. And then turn around and walk back normal once more. Good, perfect. Okay. Any trouble doing that? Any pain while doing that?
Nope.
Okay, you can take a seat back down. No pain or difficulty reported. Okay. So lastly, I'm going to wrap this up with any questions or concerns that you may have for me.
No.
No? Okay. Well, I hope you stay safe, and I do recommend you get your annual physical every year. It's super important, and I hope to see you again next year.
Okay. Thank you.
Thank you. Have a nice day.
You too.